The sloth virus spreads to Europe. What you need to know about Oropouche fever. As if the world hasn't had its fill of global health scares, another virus is making headlines: the Oropouche virus, ominously nicknamed the sloth virus. Once confined to the dense jungles of South America, this viral disease has now made its way to Europe, raising new concerns among public health officials. With over 10,000 cases reported this year alone and the first deaths confirmed in Brazil, what do we really know about the Oropouche virus, its risks, and its unexpected journey across the Atlantic? The journey of Oropouche virus from the depths of the Amazon to European shores. The spread of Oropouche virus. The Oropouche virus was first discovered in the 1950s in Trinidad and Tobago, near the Oropouche River. This obscure virus, previously only of regional concern, has now caught the attention of global health authorities. Known for causing Oropouche fever, a disease that can be debilitating but was not thought to be deadly, the virus has suddenly emerged as a more serious threat. Oropouche virus is transmitted to humans primarily through the bites of infected midges, tiny insects similar to mosquitoes. Some species of mosquitoes can also carry and spread the virus. The virus's nickname, Sloth Virus, derives from its suspected natural reservoirs, which include pale-throated sloths, non-human primates, and rodents. These animals carry the virus, and it spreads to humans through the bites of insects that have fed on infected animals. A grim milestone. The first recorded deaths. The Oropouche virus crossed a significant and alarming threshold this year with the first confirmed deaths in Brazil. 2 young women with no pre-existing conditions succumbed to the virus, highlighting its potential lethality. These fatalities have put the spotlight on the virus, prompting renewed research and scrutiny. The Brazilian Ministry of Health has also raised concerns about the possibility of the virus being transmitted from mother to child during pregnancy. Although research is still in its early stages, there have been reports of the virus being present in infants born with microencephaly, a condition where a baby's head is significantly smaller than expected, which can lead to developmental issues. This raises troubling questions about the potential impact of the virus on pregnant women and their unborn children. Symptoms and diagnosis. What to look for identifying Oropouche fever. Symptoms and diagnosis. The symptoms of Oropouche fever can easily be mistaken for other tropical diseases like dengue or Zika, making diagnosis challenging. Common symptoms include fever, severe headache, chills, muscle and joint pain, nausea and vomiting, sensitivity to light. These symptoms typically appear 4-8 days after an individual is bitten by an infected midge or mosquito. In most cases, the symptoms last for about a week and then resolve on their own. However, in rare instances, the disease can lead to more severe complications such as meningitis or encephalitis, which involve inflammation of the brain and its surrounding tissues. Given these overlapping symptoms, medical professionals often have to rely on a combination of clinical presentation and recent travel history to diagnose the disease. Laboratory tests are also available to confirm the presence of the virus, but these are not always accessible in all regions, particularly in remote areas where the virus is most common. Why is the virus spreading now? Climate change and other contributing factors. The recent increase in Oropouche virus cases is concerning and can be attributed to several factors, with climate change being a significant one. Changes in global temperature and precipitation patterns have created more favorable conditions for the midges and mosquitoes that spread the virus. Warmer weather speeds up the life cycle of these insects, leading to larger populations and a higher risk of virus transmission. Enhanced surveillance and better reporting have also played a role in the apparent rise in cases. As more health organizations become aware of Oropouche fever, more cases are being identified and reported, adding to the growing concern over this once ignored virus. The European invasion. How did it happen? Oropouche virus in Europe. Should we be worried? For the first time, cases of Oropouche virus have been reported in Europe. In June and July of this year, 19 cases were identified in Spain, Italy, and Germany. However, It is important to note that all of these cases were imported. The patients had recently traveled to Cuba or Brazil before developing symptoms. The European Centre for Disease Prevention and Control, ECDC, has assessed the risk of a local outbreak in Europe as extremely low. This is largely because the species of midges that transmit the virus in the Americas are not currently found in Europe. Nonetheless, the presence of the virus on the continent, even in isolated cases, is a stark reminder of how easily diseases can spread in our increasingly interconnected world. How to protect yourself preventing infection. What you can do given the absence of a vaccine or specific treatment for Oropouche fever, prevention is crucial. The best way to protect yourself from the virus is to avoid being bitten by the insects that carry it. Here are some practical steps you can take. Use insect repellent. Apply repellent containing DEET or another effective ingredient to exposed skin and clothing. Cover up. Wear long sleeves, pants, and socks to reduce the amount of skin exposed to insect bites. Sleep under a mosquito net. Especially in areas where the virus is prevalent, use insecticide-treated bed nets to protect yourself while you sleep. Stay informed. If you plan to travel to areas where Oropouche virus is present, check the latest health advice and take appropriate precautions. The ECDC also recommends using insecticide-treated fine mesh mosquito bed nets, as the midges responsible for spreading the virus are small enough to slip through standard mosquito netting. The global health challenge, the emergence of Oropouche virus in Europe, is a reminder that infectious diseases do not respect borders. As climate change continues to alter the ecosystems in which these diseases thrive, it is likely that we will see more instances of viruses like Oropouche appearing in new regions. Staying informed, taking preventive measures, and supporting ongoing research are essential steps in protecting ourselves from these emerging threats. If you found this article helpful, please share it with others who might benefit from this information. Don't forget to like, subscribe, and comment on our channel for more updates on global health issues. Your support helps us continue to bring you the latest and most important news in the world of public health. Stay safe, and stay informed.